I present to you Dr. Stephen Brotherton, President of the Texas Medical Association.
Thank you. I'm going to start by recognizing the person that's most responsible for me being here, and that's my mother, Vivian Brotherton. Mom, would you stand up, please? Stand up. And you turn around and wave at everybody. Tell everybody where you are. Yeah. Okay. I did that first for a couple of reasons. One is a lot of you that are mothers know she's still my mother, and so if any of you are back there playing Temple Run 2 or doing any side business, she will get up and come over and thunk you on the head. So underestimate her at your own risk. And the second reason is I want to talk about her. My mother was much more intelligent, much more intuitive than anybody else that was raising kids at the same time she was. And as such, she kind of eschewed any traditional child-rearing things that she couldn't prove to herself that were useful. So she left a lot of those things out. Now, we do that, and we call it evidence-based medicine. We're very proud of it, and we think it's pretty neat. But it's nothing but dialectical reasoning. It's been around about 24 centuries. She was doing evidence-based parenting. She just didn't bother to give it a name. So there's a lot of things that she just didn't do. Now, the reason I know this is that my sister is much younger than I am, so I was able to see this the second time around and watch what she was up to. And by the way, those of you that are worried about qualities like politeness and consideration and kindness to people and why I have basically none of those, that's because between the two of us, my sister got them all, and that's proven frequently, but most appropriately at this point, she's here all the way from Charlotte, North Carolina for this event. Kelly, would you stand up, please? Yeah. So some of the things that she left off included some of the Mother Goose style fairy stories that got told because they have no context and they have no moral in today's world. To wit, Jack and Jill went up the hill to fetch a pail of water. Jack fell down and broke his crown, and Jill came tumbling after. And what's the moral of that story? Don't go up the hill with loose women? I mean, yeah. And now, how many of you that know me as I am today, annoying, abrasive, self-referential, autodidact, think that when I was little, I was somehow cute and sweet and cloying? Raise your hands. Right. Okay. All of you with your hands down are correct, and you'll notice that my mother raised her hand, but she hesitated. You know, so motherhood, you know, there's support despite all evidence to the contrary. No, if you'd have come to me with a rhyme like that, well, I said, okay, why is the well at the top of the hill? Isn't the water closer at the bottom of the hill? And if they already got the water at the top of the hill, why don't they pull a sluice or a pipe or something and bring it down? And besides that, why didn't they give them a bucket that was too big for any of them to carry? Now, at this point, Mom would have been happy that I hadn't dissected it back to its original form, which is probably pretty close to what Andrew Dice Clay had, which was Jack and Jill went up the hill. They both had $1.25. Jill came down with $2.50, you know, but excuse me, I got a little bit of a cold here. Now, here's another one. Humpty Dumpty sat on a wall. Humpty Dumpty had a great fall. All the king's horses and all the king's men couldn't put Humpty together again. Anybody got a moral of that story? Okay, well, let me help you out because I got 4. First of all, the king can't direct health care. I don't care how beneficent, how well-meaning, how well-informed. Yes, yeah. While we're on that, where was the king's surgeon? Off fighting the war, obviously, because all the king's horses and all the king's men are in Dumpty County trying to do egg surgery, okay? Second thing is, what was Humpty doing sitting up on the wall in the first place? Risky behavior. What do you do to keep people from engaging in risky behavior? Get ready, Mom, they're not paying attention. Okay. Primary care doctor. Lots and lots of studies that show that if you have a medical home, if you have a primary care doctor, you will live longer, live healthier, live better. You will engage in less risky behavior. Humpty was up on the wall because he didn't have a primary care doc. In point of fact, he couldn't get one, but we'll get to that in a second. Yeah. He was already in trouble because his cholesterol was through the roof, and if our pictures are accurate, his BMI was about 45, but that's beside the point. Third moral of the story, the wall through the middle of town. I mean, what's this health hazard doing in the middle of town, and who should address that? Now, before I saw how the reference committees were going, I was explaining how the Fantasy National Medical Society and the Gooseland State Medical Association were not the place to start that, but that's been edited out. The point is, and trust me on this, the place to start that is with the Dumpty County Medical Society. But there's a problem with that. The Dumpty County Medical Society wasn't quite as functional as it should have been. Very rural county, very Medicaid dependent, and not a lot of new doctors coming into town. Now, the leaders in Dumpty County had been trying valiantly to keep this place going as long as they could, but frankly, they were fatigued. They needed new help. Now, what the king tried to do was up-credential limited license providers to help provide that service. What he should have done was red tape abatement, loan repayment programs. God forbid you even put money back in the system, but instead he up-credentialed squires and horses is why what we got, the results have been recorded historically. Now, which gets me to the fourth moral of the story. I don't care who tells you otherwise, king or whatever, if you're a horse, you're not a trauma surgeon. And now, picture this with the hooves and the whole thing like this. You know, can you come up with anything more ridiculous than that? He's making things worse. Can you think of anything more ridiculous? Well, no. Okay, let me help you again because I got about 5. How about an optometrist who's giving eye drops that are cardiogenically active in the course of practice to a patient? Because in my front row, people that don't have medical training, drop for drop, things in your eye are about the same thing as IV. So if you get a guy who's never been to medical school and giving you drops in your eye that can affect how your heart works, it can kill you. Okay? How about a physical therapist doing needle EMGs to derive their own diagnosis and then go on and treating the patient without ever involving the doctor? Okay? How about a podiatrist who's doing CAFR sessions on a habitual toe-walking 12-year-old? And I'm not talking about a kid with cerebral palsy who's diplegic. I'm talking about a little bit short kid who's a habitual toe walker. How about a nurse practitioner working for a company that owns drugstores, working in the drugstore, writing prescriptions for antibiotics for every scratchy throat and runny nose that comes in the door? And again, for my folks in the front row without medical training, those are caused by viruses almost all the time, and they're going to run their course regardless of the antibiotics. All that's going to happen if you do that is grow out more resistant bacteria. The drugstore loves it because they get to fill the antibiotic prescription, and the next time they get to fill one for more expensive antibiotics because you've got resistance to that. But it doesn't do the patient any good. How about a psychologist writing a prescription for neuroleptics? And again, for my folks in the front, that can kill you too. So I will hold out to you that any of those things I just gave to you is more ridiculous than the horse because he is, of course, a fantasy. The others are real, and they're all happening except for one. It's states that butt up against our state right now. Our neighbors are letting that happen. The one exception is the podiatrist that's doing CAFR sessions on the 12-year-old, and that's not because we didn't do what we should have done in the legislative session and stop that. Not that we didn't go at expense to do this, but go fight that in the courts. But it's because some, not all, some of our friends in the hospital systems up-credentialed those people, and that was still in doubt. When that was clarified, they came back to us and said, what should we do now? If we take their credentials, they might sue us for restraint of trade. What would you do? Gee, I don't know. Think about patient safety. There's a thought. So now, if you want a sort of a preview of what I'm going to be up to and what I'm going to be emphasizing as president, you just had it. The first thing is feds out of health care. Is that quixotic? Is that... Is that tilting at windmills? I don't know, and I don't care. So there you go from your president, ignorance and apathy right off the bat. The point is, sometimes the only moral answer is no. That's the only answer you get. Winston Churchill was fond of putting words in the mouth of ancient figures and defying you to say if they did or not. And he once said that Alexander the Great said that the Asian people were enslaved because they never learned to pronounce the word no. Now, I'll leave it up to you to decide for yourself if Alexander the Great really said that, or if in fact just making your way to the Indus River constitutes enslaving the ancient people. The point is not historical, it's political. Sometimes the only moral answer is no. Maybe you don't think you're going to win, maybe it's going to cost you. Still, the only moral thing to do is to say no. Feds in healthcare, no. Second thing, Second thing, primary care. Primary care is suffering. It's getting harder for people to do what they're doing right now. If you grew up when I did, primary care was the practice of medicine. Marcus Welby was a family doctor, and you cannot safely take care of people with a bunch of specialists like me cobbling together all their pieces of the patient and think that's comprehensive care. Primary care failing for doctors to be able to practice that, at least in this state on my watch, is not going to go unanswered. Not going to happen. No. Yeah. Third thing, county medical societies. Maybe California can get by without their county medical society system, but we cannot do it. That's where we get legislation started when it needs to get going. That's where we stop bad legislation. We would not have passed Prop 12 without doing that at the county level. If we'd have tried to do that in Austin, wouldn't have worked. We probably got it done. And at the very least, the things we're doing now, if we only do it in Austin, much more expensive. We got to have our county systems up and going. That's where your leadership comes from. That's where everybody at this front table came from. That's where we build that up. Our county system has got to keep going. Now, understand, I'm talking about ailing county medical societies. There are some county medical societies in this state that are doing great. They are the envy of most state medical societies. I'm not talking about that. But we have some that need some help going up, and that's going to be part of my focus. And if you've got a place that needs a visit, call me. I will come. And the last thing I've got for you, unless you've been through the Darwinian process of getting through pre-med, getting into medical school, surviving that, going on matching, going to your residency program, learning your trade, then getting out and proving that you're competent through board certification or other equivalent means, you don't get to call yourself a physician. That we just... We can't have that, and my request may be challenged to Dawn Buckingham and Darren Whitehurst for 2015. We've already got the bill passed that says if you're a medical student, resident, fellow, fully fact, you got to be identified as what you got. Is it not logical that we would have something that say Doctor of Chiropractic, Doctor of Podiatry, PhD of Nursing, so people know who's dealing and what their credentials are? Isn't that just transparency? And haven't we decided a long time ago that's very simple, basic bioethics? And if you think we've already won because the session's almost over, most of you already know this, but I'll tell you, the 2015 legislative session for us has already started. We got to get the work done now to make sure we get our goals accomplished, and most of you are already working very hard. Now, before Cliff cuts off my microphone and kicks me off the podium, I do need to introduce some people I haven't already addressed and let you have a chance to recognize them. See, I can do mother-in-law jokes, and you can't, because I love my mother-in-law very much, and she's one of my best friends, and she's here. Betty Pumphrey, would you wait? You don't have to get up unless you want to, but wave your hand. Yeah. And I've got 4 friends I want to recognize, and a couple of them I don't see, but let me get all 4 of them before you recognize them for me. First of all, Phil Anthony and his wife Mary Ann are here. Phil is a TMA member. He told me earlier, he said, I'm not a text-med kind of guy, but for you I'm going to come. If you're worried about the ability of modern medicine with information intensity merging with the old-style medicine, Phil's a good example of how that gets done. He works very well in the former system, but he still, at least when Mary Ann makes him, does house calls. And sometime we get time, I'll tell you about a pretty miraculous result of a house call he did at my house. And there are a couple of friends, and I'm not seeing them right now, but I know they're around. The biggest, greatest medical society in Texas, as great as they are, is not TMA or Tarrant County Medical Society. It is the as yet unnamed Journal Club, of which I'm a member. No elections, no bylaws, and no name for now 23 years. One member's back with a delegation, Larry Reeves, who, for my money, is the doctor we all wish we are, and the template that we really should be following. And another is Stuart McDonald, who's not a delegate, but he's president of TMLT, and they're members along with me. Would you recognize all of my friends that came today? Yeah. I got one other friend I got to recognize. When I get sort of jaded or anxious or stuff about getting to where I have been today, I take myself back to when I was a pre-med and all the angst and idealism that was mixed up together in that. And if I really want to challenge myself, I imagine while I was doing that, at the same time I was a Division I starting offensive lineman in a very competitive program, basically a really, really hard full-time job at the same time I'm doing that. A daunting process, except maybe for Dr. Strait, which based on her TMA record can do anything. But I have a friend who's done just that, and he is now a third-year medical student at UT San Antonio, Josh Carlin. Josh, wave. You don't need to stand up. You're tall enough sitting down. But yeah. And I'm going to finish up by saying something that some of you heard me say before, and it wasn't original the first time, but it bears repeating. And in my wildest dreams, I never saw myself in this position. My best friend, my intellectual partner, my academic sounding board, now forever object of all of my wildest dreams, and the other half of my heartbeat, my wife Peggy. Thanks for allowing me to be your president, and thanks for interrupting your business to listen to me, and I think we need to get back to it. Thank you very much.